Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about swimmer's shoulder, what it is, and things you can do to treat it. Swimmer's shoulder is commonly a common name for shoulder impingement. And what that means is the head of the humerus, which is this bone in your arm, is coming up and it's banging into the acromion, which is a part of this bone up here. So when that happens, you wind up inflaming tendons, which cause you pain as you swim. Swimmers are generally much tighter in the front, but do not have the rotator cuff strength to support the strength that they carry up front. We're going to show you a few exercises today to improve rotator cuff strength, to improve scapular depressor strength, and also to stretch out some of the muscles that are often neglected when you swim. You can do these exercises a few times throughout the day. You can do them with your strength training program. They should not cause you any additional pain. If they do, you want to stop immediately. If you feel you have swimmer's shoulder, you need to start to take actions to reverse some of the damage that is going on. Otherwise, it will cause you to stop swimming. The first stretch we're going to do is a Pec Minor Stretch. Now, one of the most common stretches that is done in swimming is where you have a partner grab your arm and pull it back, like this. That does nothing but stretch out the front of your shoulder, the anterior capsule, which is generally already loose with swimmers. What you want to do is concentrate on specific muscles that are generally tight when you swim. The Pec Minor is one of them. This is a partner stretch. You will need someone to help you do this. So all you want to do is come up, place your hand flat on the back of the person's shoulder, place the other hand flat on the front, have them take a deep breath in, and then as they exhale, you're just going to push back. The hand of the back is going to stabilize, the hand of the front is going to push backwards. What that'll do is feel a nice gentle stretch in through here. Be careful of where you place your front hand. If you place it too far over on the shoulder, you can wind up hurting someone as you're doing it. They'll feel discomfort as they exhale. This should not feel uncomfortable. This should feel like a gentle stretch. So you want the palm of your hand all the way over on the person's chest. And the next stretch you want to do is the sleeper stretch. So you want to go ahead and lay down on your side. You're going to turn over on your side. And all you're going to do is bring your arm out to 90 degrees. You're going to push down with this hand until you feel a stretch. Ideally, you're going to touch the table or the floor or wherever you're doing this stretch. If you can't get there right away, that's okay. Most swimmers, if they've never done this stretch, their arm will be up here, and that's okay. Do not force this down. You will feel pain if you force it down. Go to where you feel a nice gentle stretch, even if your arm's straight up in the air. Go to where you feel a nice gentle stretch and hold that. You want to do 30 seconds, 6 times. Switch and then do the other side, 30 seconds, 6 times. You should incorporate this every day into your routine, whether you're having problems with your shoulders or not. The final exercise you want to do is called scap depression. So you're just going to sit on the side of a table, counter, whatever surface that you have, and all you want to do is push down. You want to lift your legs up off the table and your butt. You want to do this nice and slow. As this gets easier, you can hold this for a count of 5 or 10. You want to do about 30 of these a day. This is not only going to help with your abs, but it's also going to help with everything in the back that generally gets neglected when we swim.